So this is a little bit of, thank you, Janet and Patrick. This is a little bit of a harder one. I know I've personally experienced this challenge is time. There's from the time here, like, for example, when you submit a grant proposal or you submit an IRB application, a protocol, it has to go through the COI office before it will be acted upon. So can you give us a sense of the length of time? I know some of them, as you said, you can handle yourself, to what's the longest it might take. Like, just not that we would hold you to that, but like just give people a sense so that they can plan better than I do sometimes.
No, absolutely. And I think, and it's, we're always kind of evolving and getting better at what we do. So I also like to think that as the years have gone by and we've refined our process and just gotten better at our jobs, the time is a little bit less. But it also depends on a lot of factors. As you noted, if it's something that we can administratively approve, then we can usually turn it around really quickly. It should, I think, certainly in a matter of weeks, that we can do that. If it's something that has to go to the full conflict of interest committee, it takes more work to prepare for that. And then, the committee is scheduled monthly, but won't always meet if there's nothing sort of on the agenda. So there's sometimes where the timing doesn't work out and you have to wait for the next month. And then if the committee has questions, then that can delay things too. If Penn also has to review it, that can take some additional time. This is why that being proactive and that prep work that Janet had mentioned is so important, because the more we can have things kind of wrapped up in a nice little bow for a committee, and then be prepared to answer all their questions and try to anticipate them, the smoother that process will go. And the more likely it is that, literally at 5 o'clock in the afternoon when that meeting's over, we have a resolution, and then we just have to draft up a formal letter to sort of document it. So otherwise, it is a little bit tough to say. I think that, the worst case scenario, I think, and unfortunately, it's been a long time since we've had one that took so long, but we've had something take 3 or 4 months to really do the prep work and get it all together and get all the facts that we need in place to get that to committee, to bring it back to committee when there are questions, to get it over to Penn and have that all resolved. There have been some that have dragged on for a while. Those are also really more the exception than the rule, and they're usually, very kind of high profile and higher risk research. We're talking about clinical trials where there's individual and institutional conflicts, and like the Spark therapeutic trials that we conducted years ago. Those went through the ringer and they got a lot of scrutiny, and rightfully so, because we had a massive institutional interest. We had some of the investigators who were inventors of some of the technology that was being employed. So that was a major risk for the institution, but we were the safest place to conduct those trials and really best suited to do it. But it took a lot of work, and we were very cautious in how we proceeded. So those ones certainly took more time.
And we did well. The kids did well, we did well, everyone did well in the end. So hats off to Janet and her team for making that happen. And I know Zev was really part of all of that work too, from Iowa and from here. So thank you to all of you. And I'm sure, Patrick, you're involved. So, that is something to really keep in mind for investigators who are on this. I want you to think about time. Time is really a hard thing. I have had personally challenges, and I just want to know if there's anything we can do moving forward. But I think some of the things Patrick's put in place are good. But, if I have somebody come to me and say, I have end of the year money to do X, and it involves my invention, my work, it's really hard to get those through. That's really just the reality is that is hard to do because program officers will do that. If you have time limited things, those are sometimes hard. But what can happen as time goes on is that there can be a template. Like, okay, Flora, what are you using it for? What are you doing? I think what becomes hard is when it's new, when it's a completely new thing. So can you tell us a little bit about how we've tried, although sometimes it hasn't been pretty, but how we've tried to make it so that the time wasn't as long? Because that's really, to be honest with you, it's not the decisions, it's usually the time. And I think that's something the investigators need to know, that that's the biggest issue. And you've heard time all mentioned many times. Go on, Patrick, you look like you want to say something about it.
Well, I was just saying that's actually how we got to have the administrative review process to begin with. Because in the early days of our faculty-based committee, which is I think that was 2011, January of 2011 was the first time they met, we brought absolutely everything to them. And so as they started to establish precedent and kind of made the same decisions under certain circumstances, we kind of documented that for them and said, out of the last 30 sort of cases that we've reviewed, when circumstances A, B, and C are true, this has been the resulting management. And so can we just kind of carve that in stone a little bit and say, if notwithstanding anything else that might be different, if these elements are the same, can we then just administratively review them without bringing them to your full attention? And which is why the vast majority of reviews that we do every year, which is I think at this point upwards of nearing 300 that will be administratively approved, where we probably bring another 50 per year to the conflict of interest committee. And so it has been a major shift and allowed for much more expedited process with that. And then I think the other things that we do is as you mentioned, when we have things that are very similar to things the committee has already looked at, we do try to bring to them what precedent we have. So even if it's another diagnostic driving study for Dr. Winston, they've seen these before, and we can say that these specific things, these are the facts that have changed, or the things that are different, and they should not be material to a conflict of interest analysis, or maybe they should, but we'll really just have them focus on those things they need to, and otherwise say, is there any reason to do something different than what we did last time? And that makes it a lot easier, I think, for the committee. And it wouldn't necessarily have to be your own research. We can use other examples of similar circumstances to say that, this rises to a level that still requires the full committee's attention. But it's very similar to something that you saw a couple months ago. And, so we're recommending that we take the same course of action. But there is work to be done here, and taking too many shortcuts with it, I think, is to the detriment and to the disservice of our investigators and of the institution. So I know it can be a little bit of a pain point, but it really is worth it. And I think that the work is important and it's very protective. So we do everything we can to not drag things out. As Zev said earlier, the last thing we want is to be a burden or to slow things down or to be in the way. But we have to be protective of the institution, and it's sometimes that takes a little bit of time.